Top 3 vitamins to lower blood sugar and control diabetes naturally. Are you unknowingly making your diabetes worse? What if I told you that a single vitamin deficiency could be silently damaging your blood sugar, nerves, and even your heart without you even realizing it? Studies show that up to 80% of diabetics are dangerously low in vitamin D, a deficiency that can increase insulin resistance, spike blood sugar, and even lead to serious complications like nerve damage, kidney disease, and heart failure. If you're feeling fatigued, experiencing constant sugar crashes, nerve pain, or slow healing wounds, your body could be screaming for vitamin D, but you might not even know it. The worst part, doctors rarely test for this, leaving millions at risk. But don't worry, by the end of this video, you'll know exactly how to check, fix, and protect yourself before it's too late. Stay tuned, your health depends on it. Most diabetics focus on diet, exercise, and medications. But what if I told you that a hidden vitamin D deficiency could be making your blood sugar worse? Low vitamin D has been linked to insulin resistance, high blood sugar, nerve damage, and even heart disease. In this video, I'll reveal why diabetics are at higher risk, the warning signs of deficiency, and how to fix it fast. Stay tuned. Vitamin D. Are you unknowingly making your diabetes worse? What if I told you that a single vitamin deficiency could be silently damaging your blood sugar, nerves, and even your heart without you even realizing it? Studies show that up to 80% of diabetics are dangerously low in vitamin D, a deficiency that can increase insulin resistance, spike blood sugar, and even lead to serious complications like nerve damage, kidney disease, and heart failure. If you're feeling fatigued, experiencing constant sugar crashes, nerve pain, or slow healing wounds, your body could be screaming for vitamin D, but you might not even know it. The worst part, doctors rarely test for this, leaving millions at risk. But don't worry, by the end of this video, you'll know exactly how to check, fix, and protect yourself before it's too late. Stay tuned, your health depends on it. Most diabetics focus on diet, exercise, and medications. But what if I told you that a hidden vitamin D deficiency could be making your blood sugar worse? Low vitamin D has been linked to insulin resistance, high blood sugar, nerve damage, and even heart disease. In this video, I'll reveal why diabetics are at higher risk, the warning signs of deficiency, and how to fix it fast. Stay tuned. Vitamin D isn't just important for strong bones. It plays a critical role in blood sugar regulation and insulin function. Insulin sensitivity. Studies show that vitamin D helps the pancreas produce insulin and makes cells more responsive to it. Without enough vitamin D, insulin resistance increases, making it harder to control blood sugar. Inflammation control. High blood sugar causes chronic inflammation, which damages organs. Vitamin D reduces inflammation and protects against diabetes-related complications. Nerve protection. Diabetes can cause nerve damage, neuropathy, leading to tingling, numbness, and pain. Vitamin D supports nerve function and may slow nerve deterioration. Heart and kidney health. Uncontrolled diabetes damages the heart and kidneys. Vitamin D plays a role in reducing heart disease risk and protecting kidney function. Now that you know why vitamin D is essential for diabetics, let's talk about the warning signs of deficiency. Millions of people, especially diabetics, are deficient in vitamin D without realizing it. Here are some of the warning signs your body might be giving you. Uncontrolled blood sugar. If your blood sugar is fluctuating more than usual, low vitamin D could be a factor. Constant fatigue and weakness. Feeling drained all the time? Low vitamin D could be affecting your energy levels. Muscle pain and joint stiffness. Aches, cramps, and slow recovery after exercise can indicate a deficiency. Frequent infections. If you're getting sick often, your immune system may be weakened due to low vitamin D. Slow healing wounds. Cuts and bruises taking longer to heal. Vitamin D plays a role in tissue repair. Nerve pain and tingling. Symptoms of diabetic neuropathy can worsen with low vitamin D. Depression and mood swings. Low vitamin D has been linked to depression and anxiety. If you're experiencing any of these symptoms, you may have a deficiency without knowing it. But what causes this deficiency? There are several reasons why diabetics are at a higher risk of vitamin D deficiency. Limited sun exposure. Vitamin D is mainly produced when sunlight hits your skin. If you spend most of your time indoors or live in a colder climate, your body isn't producing enough. Obesity. People with higher body fat levels have lower circulating vitamin D, as fat cells store and trap it, making it less available for use. Poor diet. Most foods don't naturally contain vitamin D. If you're not eating enough vitamin D-rich foods, deficiency is likely. Kidney dysfunction. The kidneys help convert vitamin D into its active form. Since diabetes increases the risk of kidney disease, this conversion process may be impaired. Age and skin tone. As we age, the body becomes less efficient at producing vitamin D. People with darker skin tones also need more sun exposure to produce the same amount of vitamin D as lighter-skinned individuals. So, how can you get enough vitamin D? Sunlight, the most natural way to increase vitamin D. Aim for 10 to 30 minutes of direct sunlight on your skin several times a week. Vitamin D-rich foods, fatty fish, salmon, tuna, mackerel. Egg yolks, mushrooms. Fortified foods, milk, orange juice, cereals. Supplements. If your vitamin D levels are very low, your doctor may recommend supplements. The recommended daily intake varies, but most adults need 600 to 800 IU per day, while those with a deficiency may need higher doses under medical supervision. If you suspect a vitamin D deficiency, ask your doctor for a 25-hydroxy vitamin D blood test. This is the most accurate way to check your levels. Experts recommend maintaining vitamin D levels between 30 to 50 nanograms per milliliter for optimal health. If your levels are below this, you may need dietary changes or supplementation. Vitamin B9. Are you unknowingly putting your health at risk? What if I told you that a single vitamin deficiency could be silently affecting your brain, heart, and energy levels without you even realizing it? Vitamin B9, also known as folate, is one of the most essential nutrients for your body, yet millions of people are deficient. A lack of vitamin B9 can lead to serious health problems, including anemia, fatigue, brain fog, poor digestion, and even birth defects in pregnant women. If you experience constant tiredness, memory issues, or frequent headaches, your body could be desperately lacking vitamin B9, but you might not even know it. The worst part? Many people don't realize they're not getting enough from their diet, and by the time symptoms appear, the damage could already be happening inside your body. But don't worry, by the end of this video, you'll know exactly how to identify the signs of vitamin B9 deficiency, the best food sources to boost your levels, and how to keep your brain and body healthy. Stay tuned. Most people think of vitamins like B12 or vitamin D when it comes to energy and brain function, but vitamin B9 is just as important. This powerhouse nutrient plays a major role in DNA production, red blood cell formation, and even mental health. In this video, I'll reveal why vitamin B9 is essential for your body, how to recognize deficiency symptoms, and the best ways to make sure you're getting enough every day. Why vitamin B9 is important. Vitamin B9, also known as folate or folic acid in its synthetic form, is a water-soluble vitamin that your body needs for red blood cell production, helps prevent anemia by supporting healthy blood cell formation, DNA and cell growth, essential for proper cell division and tissue development, brain and nervous system support. Low folate levels have been linked to depression, memory loss, and cognitive decline. Heart health helps lower homocysteine levels, reducing the risk of heart disease. Pregnancy and fetal development, crucial for preventing neural tube defects in babies. If you don't get enough folate, your body struggles to function properly, and over time, serious health issues can develop. Signs of vitamin B9 deficiency. Millions of people are deficient in vitamin B9 without even realizing it. Here are some common signs that your body may be lacking this essential nutrient. 1. Constant fatigue and weakness. Low folate levels can cause anemia, leading to extreme tiredness. 2. Shortness of breath and dizziness. A folate deficiency reduces oxygen flow in the blood. 3. Pale skin. Poor red blood cell production can make your skin appear pale or yellowish. 4. Brain fog and memory problems. Struggling with concentration? Low folate affects brain function. 5. Depression and mood swings. Folate is essential for serotonin production, impacting mental health. 6. Frequent mouth sores and swollen tongue. A lack of folate can cause ulcers in the mouth and a swollen, sore tongue. 7. Digestive issues. Deficiency may lead to poor digestion, bloating, and even diarrhea. 8. Poor immune function. Folate is needed for white blood cell production to fight infections. 9. Complications in pregnancy. Low folate increases the risk of birth defects and pregnancy complications. If you're experiencing any of these symptoms, it may be time to check your folate levels. Causes of vitamin B9 deficiency. Folate deficiency can happen for several reasons, including poor diet. If you're not eating enough leafy greens, beans, or fortified foods, your intake may be too low. Alcohol consumption. Excess alcohol depletes folate levels and affects absorption. Digestive disorders. Conditions like celiac disease or IBS can reduce folate absorption. Certain medications, some drugs including birth control pills and anti-seizure medications, can lower folate levels. Pregnancy. The body requires more folate during pregnancy for fetal development, increasing the risk of deficiency. If you fall into any of these categories, it's important to make sure you're getting enough folate daily. Best food sources of vitamin B9. To prevent deficiency, include these folate-rich foods in your diet. Leafy greens, spinach, kale, and lettuce are excellent sources. Legumes, lentils, chickpeas, and black beans are high in folate. Citrus fruits, oranges, lemons, and grapefruits provide natural folate. Eggs, a good source of folate, along with other essential nutrients. Avocados, rich in folate, and healthy fats for brain and heart health. Fortified foods. Many cereals, breads, and pastas are fortified with folic acid. Beets, naturally high in folate, supporting blood and liver health. Nuts and seeds. Sunflower seeds and almonds contain a good amount of folate. Make sure you're including these foods in your diet regularly to maintain healthy vitamin B9 levels. When to get tested? If you suspect a vitamin B9 deficiency, ask your doctor for a serum folate blood test. This will determine if your levels are too low. Experts recommend that adults get at least 400 micrograms of folate per day, while pregnant women need around 600 micrograms to prevent birth defects. Vitamin B12. Are you feeling constantly tired, weak, or forgetful? What if I told you that a simple vitamin deficiency could be silently damaging your brain, nerves, and energy levels without you even realizing it? Vitamin B12 is essential for your body's energy production, brain function, and red blood cell formation. Yet millions of people, especially vegetarians, older adults, and those with digestive issues, are unknowingly deficient. A lack of vitamin B12 can lead to severe fatigue, nerve pain, memory problems, and even irreversible nerve damage. If you often experience numbness, mood swings, or dizziness, your body could be screaming for B12, but you might not even know it. The worst part, B12 deficiency can go undiagnosed for years, and by the time symptoms appear, the damage may already be happening inside your body. But don't worry, by the end of this video, you'll know the warning signs of B12 deficiency, the best food sources, and how to restore your levels before it's too late. Stay tuned. Most people think of vitamins like vitamin D or iron when it comes to energy and brain health, but vitamin B12 is just as important. It plays a key role in nerve function, blood cell production, and metabolism. In this video, I'll reveal why vitamin B12 is essential, how to spot deficiency symptoms early, and the best ways to ensure you're getting enough B12 every day. Why vitamin B12 is important. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that your body needs for essential functions, including red blood cell formation, prevents anemia and supports oxygen transport, nerve protection and brain function, helps prevent nerve damage, cognitive decline, and brain fog. Energy production. Supports metabolism and helps reduce fatigue. DNA synthesis, essential for cell growth and repair. Mood and mental health. Low B12 levels are linked to depression, anxiety, and mood swings. A lack of vitamin B12 can lead to serious long-term complications, so it's crucial to recognize the warning signs early. Signs of vitamin B12 deficiency. Millions of people are deficient in vitamin B12 without even realizing it. Here are the most common warning signs. 1. Extreme fatigue and weakness. Feeling drained even after a full night's sleep. B12 helps convert food into energy. 2. Tingling or numbness in hands and feet. Nerve damage from low B12 can cause a pins and needles sensation. 3. Memory loss and brain fog. Difficulty concentrating or forgetfulness could be linked to B12 deficiency. 4. Dizziness and lightheadedness. B12 is needed for proper oxygen circulation, and low levels can cause dizziness. 5. Pale or yellow skin. Poor red blood cell production can make the skin appear pale or jaundiced. 6. Shortness of breath and rapid heart rate. Anemia caused by B12 deficiency reduces oxygen in the blood. 7. Mouth sores and glossitis. A swollen red tongue or frequent mouth ulcers may be a sign of deficiency. 8. Depression and mood swings. B12 plays a role in serotonin production, which affects mood regulation. 9. Poor appetite and weight loss. Low B12 levels can cause digestive issues and reduced hunger. 10. Vision problems. Severe deficiency can damage the optic nerve, leading to blurry vision. If you're experiencing multiple symptoms, it may be time to check your B12 levels. Causes of vitamin B12 deficiency. B12 deficiency is common, especially in certain groups. Here's why you might be at risk. Poor diet. Found mostly in animal-based foods, so vegetarians and vegans are at higher risk. Aging. As you get older, stomach acid production decreases, making it harder to absorb B12. Digestive disorders. Conditions like celiac disease, Crohn's disease, and IBS can interfere with absorption. Medications. Certain drugs, including metformin, for diabetes and antacids, can lower B12 absorption. Excess alcohol consumption. Alcohol can reduce stomach acid and affect nutrient absorption. Pernicious anemia, an autoimmune condition that prevents B12 absorption from food. If you fall into any of these categories, it's crucial to monitor your B12 intake. Best food sources of vitamin B12. Unlike some vitamins, B12 is mostly found in animal-based foods. Here are the best sources. Animal liver and kidneys, the most concentrated source of B12. Shellfish, clams, oysters, and mussels are loaded with B12. Fatty fish, salmon, tuna, sardines, and trout provide high amounts of B12. Dairy products, milk, yogurt, and cheese contain moderate levels of B12. Eggs, especially the yolk, which has B12 foods. Certain cereals, plant-based milks, and nutritional yeast are enriched with B12. If you're vegetarian or vegan, fortified foods or B12 supplements may be necessary to meet daily requirements. When to get tested. If you suspect a B12 deficiency, ask your doctor for a serum B12 blood test. Experts recommend that adults get 2.4 micrograms of B12 daily, but higher amounts may be needed for those at risk. Maintaining optimal B12 levels can help prevent fatigue, nerve damage, and cognitive decline, so don't ignore the warning signs. Vitamin deficiencies could be silently making your diabetes worse, but now you know which ones to focus on. Don't let low vitamin D, B12, or magnesium sabotage your blood sugar control. Which of these vitamins are you already taking? Let me know in the comments. If you found this video helpful, hit the like button and subscribe for more diabetes and nutrition tips every week. Share this video with friends and family who need to manage their blood sugar naturally, because health starts with the right nutrition. Would you like a pinned comment suggestion or a video description to match this?